start, and I'm going to start with apologies. And at the outset, I'm giving apologies for our Director of Public Health, James Williams, and he's given me permission to share with you. James is unexpectedly unwell, and he's had a period in hospital. And for him and for his family, it's all been quite a shock. But we're in touch with him. David and Ailish and Scott are very ably stepping in for James under Leanne's direction, and he's making good progress and should be home soon. And obviously, I have sent from everybody. You know, James is well reputed, well thought of, well loved across the council, and it's been really important, I think, as a council family and the health community to make sure that he gets all of our best wishes. And I guess, you know, we all can think that we're invincible, but you don't know what's round the corner. So I'm pleased to be able to say that from James and send a positive message for him. And under Leanne's direction, we'll be managing him coming back to work whenever he's ready in whatever circumstances that takes. So that's, if you like, that's our first kind of public acknowledgement, guided by James and his family. And I'm sure everybody around the table would send back best wishes. Okay, thank you. So we've also had apologies from Councillor Hackwell, and thank you, Councillor Tijan, for stepping in. From Paul Bentley at the ICB, welcome to Morty Varshni, who's been here before for the ICB today. Apologies for Jackie Brown, who's on leave. From Martin Riley at MCH. From Raj Picarda, yeah, thank you. Sorry, I'm just handwritten one there. And we invited guests Dr. Caroline Rickard from LMC and Adrian Richardson, as usual, from KMPT, have both apologised. And just this morning, I had apologies from Jane Black from Medway Maritime Trust, but Matt's very kindly joined us today in Jane's place. It is holiday time. And for the first time to the board, welcoming Ian Gilmore, who's going to help us with the community safety plan item. And I think suffice to say today that all of the items on the agenda are items where partnership, working together, making sure that this board gives as big a contribution as we can to the forward going of the plans that we're going to look at in the items today is really important. So with that, I'm going to ask you if the record of the meeting that we had on the 15th of February is correct, please. Okay, thank you. And are there any urgent matters? I haven't got any. Are there any declarations of disclosable pecuniary interests and other significant interests, please? Okay, thank you. And so I'll move to page 19 and ask Leanne to take us through the corporate parenting update, reminding everybody who's here for the council that we're corporate parents. We did ask if one of our care experience young people might like to come along today, and had some feedback saying, well, yes, they might like to come along, but they wondered how they'd feel about a forum like this. And I think there's a job for me to do as chair and for all of us to do, to think about actually how this kind of meeting arrangement makes younger people feel who are not used to those kinds of arenas, and perhaps going forward, think about how we can perhaps do something a bit differently. We want to hear the views of people who are not used to coming along to such a formal situation. Yes, Simon. Yep, 100%. Thank you, RAC, for always letting us come here, as far as that's concerned. But that's absolutely right. It is an intimidating venue, and also the acoustics are a bit awkward as well. So all of these things I think it's important to take into consideration. So thank you very much, Leanne.
Thank you, Chair. This report is, as it says, a report to this board about the work of the Corporate Parenting Board. from April 23 to February of this year. There's been much good work. There's been a lot of progress in terms of the Corporate Parenting Board. The Corporate Parenting Board itself, of course, does have young people representation on it, so we may well be able to ask that board to help us determine how best to engage young people with this board. Having said that, there are several issues with the performance around corporate parenting. Of course, during this period, Ofsted came in and undertook the ILACS inspection with Children's Social Care. They looked at the Corporate Parenting Board and liked what they saw. They could see the work, they could see the development, they could see the absolute commitment from Medway Council and partners to our children in care and our care leavers. I would like to say that as of Monday, Medway Council has 469 children in its care. So that equates to about 73 per 10,000. Now, by way of comparison, the South East has 57 per 10,000. And nationally, for all of England, it's 71 per 10,000. So you can see Medway does have a higher number of its children in care. Care leavers, as of Monday, we had 169, and that's 26 per 10,000 as a rate. South Eastern England has 27 per 10,000, so we're more in line with our care leavers than we are with our children in care. But one of the areas that I have been focusing on, and indeed the Corporate Parenting Board itself at its meeting a few weeks ago, is under 5.6. We do have an issue with our initial health assessments. We're working very closely with our house partners, and this is an area that the Corporate Parenting Board really wants to focus on. So more timely referrals and more timely health assessments for our children coming into care for a first time. So that's one of the areas that we need to absolutely be working on. The other thing is, most of you will know that Medway had its area SEND inspection in February of this year, and we did well. The grading for the inspection is basically there's A, B, C is deemed a failure. Medway is a B. So we didn't fail, which you can imagine I'm extremely pleased about. But all jokes aside, the partnership did really, really well in terms of how it galvanised itself and how it offers support for our SEND children, but particularly those who are in care and also have SEND. So if you haven't already seen that report, could I ask you to look at it? It is on the Ofsted website under Medway Council, so that also is a good read, and the Corporate Parenting Board will be focusing on that also. But under 5.11, the priorities there going forward, I think that would be good for today's board to discuss. Are these priorities in line for this board? How can we support, and how can we too be good corporate parents, no matter what organisation you sit in? So I'll leave it at that, Chair. Thank you.
Thank you. Any comments?
Yeah, thanks very much, Teresa, and thank you very much, Leanne, for that. This is really detailed and a report full of stuff, and it's kind of a new topic for me in many respects, although not completely new, because I'm conscious of the fact of the role of the council in relation to corporate pairing. Although it seems like a people thing, it's actually a people and place thing. It cuts across the whole. We talk about this quite often. I mean, there is a situation, for example, in planning, where planning permission for homes for children comes up, not infrequently, and being aware that we need to consult with the right people to make sure those properties are adequate and in the right place and all that kind of thing is something that has been quite contentious in the planning situation on a number of occasions, and that's something that we really need to be conscious of. And another area which might come up within the 511, looking at the future plans, is in relation, for example, just play spaces for children, making sure they're accessible for all, which currently our play spaces are not, our outdoor play spaces. So there's an issue there for green space management and outdoor play as well. But so there's some wide issues there that I was just touching on. I've got a couple of specific points, if I may, primarily to do with clarification, if you like. In paragraph 310, it talks about the shortfall of foster care, etc., and goes on. In Medway, we currently have 4 young people living in such arrangements outside of the area. So I just wanted to have a bit of an understanding and also in relation to the unregistered provision and how that's monitored if it's not registered. So there's a question around there. And paragraph 311 deals with, mentions an acronym RAA, and I wasn't clear what that meant. I've got another question after that, but those are my first couple of points. Thank you.
RAA, Regional Adoption Agency. So Medway belongs to a regional adoption agency, as it says there, Adoption Partnership South East, which is made up of Medway, Kent, County Council and Bexley. So there's the 3 local authorities that make up that. Unregistered provision is not something that we choose to use, but the market is under severe pressure. It's a nationwide issue. We always try to place our children either with foster carers through our own in-house or independent fostering agency. But you know, if there is no capacity or it depends on the individual needs of a particular child or young person, we will always look for registered provision, but that it can be quite scarce, particularly if there are individual needs that need to be met. You can't, it's not like a hotel, you just check someone in and then check someone out. There's therapeutic requirements, all sorts of things. So yes, we will use unregistered. We always notify Ofsted, absolutely every single time. And I meet regularly with the head of Children's Commissioning, James Harmon, and he will take me through the individual cases, individual children who are in unregulated or unregistered provision. So there's quite tight monitoring. We also make sure that those children are visited more frequently, depending on need. So there's a whole lot of things. And of course, I mentioned Ofsted coming for the ILACs in July of last year, and that was something that they absolutely looked at, and they were satisfied with what we were doing. But at the end of the day, it is far better for our children to be in registered provision. There is no doubt about it, absolutely none, and I wouldn't even attempt to defend anything else, but it is needs must at the end of the day. Thank you.
Another question, Simon,
Yeah,
just before you come. On that, I think this issue of unregistered provision really is a matter for government legislation. It's very, very easy, actually, for these provisions to be set up, including it within the mental health community for adults or for children, and far too easy, in my opinion. So I think for an incoming new government, that is one of the things, one of the many things that will need to be a priority, because it places local councils in as Leanne's saying, in a very difficult position. Welcome, Andrew. Nice to see you. Yeah, we're only on the first item. So Simon, your next question, please.
Yeah, thanks very much, Teresa, and that's really helpful to understand better how that operates. And I agree, I mean, it is very difficult, and we don't want it to be the case, but we're living in that sort of times at the moment. The other question I had was in relation to paragraph 5.6, in relation to healthcare and health assessments. A couple of issues that really sort of I can't. Again, clarification is helpful. Would be helpful. Firstly, the target of 80%. That seems a very low target. If you're looking at assessing children quickly within the first 20 working days, and then to only hit 55%, that's quite a concern. I think that jumps out at me as a concern. And I was just then wondering if that should be reflected again in the annual, in next year's thing about how we make proper. It's probably in there, but amongst that, making a highlight of that issue, because obviously, particularly in my own ward in Luton, where children's health issues are quite severe in some instances, getting them assessed quickly and understanding their needs is really, really important. And that goes back to, and just whilst I'm talking, reiterating my point about next year's targets, and maybe we could be looking with the local plan now underway. This is kind of separate from my first point. We should be looking at how we do deal with the public realm and young people and children's access to the public realm, making sure that that's adequate and putting that into local plan provisions perhaps. So maybe that's something that could be added into next year's targets. Thank you very much.
I mean, all good points, and I've already said that the Corporate Parenting Board itself is very determined to improve the timeliness of those health assessments. It's not good enough at the moment. And our health colleagues, I can only praise our health colleagues who are working very, very well with us. There's a whole reason why this happens, but we need to get our house in order, and I'm only too pleased to. We will be reporting an improved picture next year. Thank you.
Thank you, Leanne. I've got Councillor Peake next, and was that the end of your question, Simon? Sorry. Yeah. Councillor Peake next, then you, Councillor Tijan, then Councillor Coombs, please.
Thank you. I'm on planning committee, and again, yesterday we had a planning application where, to be fair, across party concern about the suitability of the building, the place of the building, the ratio of 3 residents to 2 staff members, and as somebody who's worked in care, that could be quite volatile, especially if you have residents that need one-to-one, often for their own health reasons. All these concerns were expressed, and because it's extremely frustrating, because none of them had anything to do with planning whatsoever, so we voted it through. I've got no idea, is there any way that we can have influence over the application? You're shaking your head. Application of licensing, that's what I was going to say. Because, Chair, you've already mentioned about going to the government and getting better guidelines. It's just so annoying. I mean, I will say, I'm not somebody who wants to rush in to interfere into the private sector. That can be a dangerous situation to do. But when you're talking about people's quality of lives and literally their health, I think there's an issue for it. So, thank you.
Look, I mean, thank you, Eddie. It's a critical point and a source of enormous frustration. I think Councillor Lauren Edwards and I are experts in the inadequacy of the planning system when this happens in wards. People, as I said before, can set up whenever they want. They are supposed to produce all sorts of plans about the level of care and the ratios that are going to be put in, but that, since it isn't covered by planning law, they can put those in whenever they want. I must say our planning department do ask for them and do try to get them, but very often the home is set up, running, occupied, with people in it. None of those plans are in place, even before planning permission is asked for. So that's why I said this is an area that at the moment the council hasn't got sufficient control over, that is one, I think, for national legislation adding to our very long list of things that need sorting out, because there is a degree, I think, very sadly, of exploitation. So sometimes by former practitioners who've worked in the area, understand that there is money to be made and jump into a caveat. So it's something that collectively we have to be as careful as we can about, and speak frankly in the way that you have done and Simon has done about. But until we've got legislation behind us to help us, it honestly is in the lap, and these places pop up all over the place.
Thank you for that. Obviously, fully agree with what you say. Yes, because you're dealing with vulnerable people, and in my experience, 5 years working in care and now 4 years of mental health, you'll be lucky if you see a family member, because a lot of people may think, oh, you know, their parents will be looking out for them, brother, sister. No, you'll be lucky you have any contact with them whatsoever. So these people are very vulnerable. Some people may think the CQC system is a bee's knees and works. I'm actually quite cynical. I have experienced myself. People come in, do a report, it's all pressure, oh, get this done, blah, 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 and it doesn't. I've had a situation where our manager has our staff in their spare time. Now, these people working a minimum wage. Imagine coming in for an extra shift, volunteering to decorate the building. You know, that's what we're dealing with here, because the company ultimately is just interested in how much money they can make.
I think your experience and insight is valuable. It needs legislation, and the CQC is struggling to keep up with it as well. Did you want to add anything? Yeah.
I totally take your point. It does sit with planning at the moment. It does sit with Ofsted, the Inspectorate for Children's, and I have very little influence on what can and can't be done. So, you know, Councillor Murray is absolutely correct. It needs a national look at and change.
Thank you, Leanne. Councillor Tijan.
Thank you. Sorry about that. Yeah. Thank you, Leon, and thank you, Chair. Thank you for your report. The report makes several references to fostering and foster care, in particular on page 21 to 23. Now, kinship carer makes up 1/5 of foster carers. They are basically our unsung heroes who have not surfaced anywhere in this report. In December last year, central government launched England's first ever kinship care strategy, which shined a spotlight on the incredible work that family members do to keep children out of care. This strategy was backed by 20 million. The government also confirmed that it would provide an allowance to many kinship carers, which is currently between £154 to £270 a week. Now, my question is, how many children currently live in kinship care in Medway, and how many kinship carers are currently receiving allowance in line with foster carers?
I'm going to have to get back to you with the exact figures, Councillor, on that one, but I can make it available to Stephanie, because that will be of interest to everyone. We're obviously aware of that focus on kinship carers, and we are doing everything we can to make sure that the ambitions and the ambitious ambitions for Medway are being progressed, but I can't give you those exact figures sitting here today. It's slightly outside of this report, but I take what you're asking, and I'll get back to you.
Thank you, Councillor Tijan. Look, that's something that's quite close to my heart. Having worked in the justice sector, I've seen kinship carers step up on the steps of the court when parents are taken into custody, and they play a huge role. And I think hitherto, particularly since the destruction of Sure Start, have been left dangling. So I was pleased to see that work from the government, but I don't think, and we'll definitely find out for you through Stephanie, that allowance is actually payable yet. I think it's a promise, but it is not payable yet and hasn't been through the benefit system. So I'm afraid the answer probably to your second part of your question is 0, because that allowance has not been made available or payable or sorted out in terms of people getting access. We do have some local kinship carer groups, and there's a really good kinship, as you probably know, organisation online that supports grandparents and other family members who find themselves in that position. but I'm afraid that allowance isn't in place yet. And the sooner it can get into place, the better, because as I say, it's a neglected area of support.
No, thank you, Chair.
Thank you for the report. I thought lots of really helpful and interesting information. I particularly wanted to talk about Section 511, which are the priorities for next year. I feel that on the Corporate Parenting Board, members of that board are really pretty well aware of what their role is. And obviously we get the voice of the child there because we have care experienced people who come along and they give their view and they give their input. But I was really interested to see the final bullet point in our priorities for next year, which is the programme of well-planned visits for members of that board, because it's a very different experience to go and meet with people in the care sector than to sit on the board and hear of their views there. So I think that would be a really great idea and give them a much deeper understanding of what their role is. I think as well, we were talking earlier about how we get the voice of the child in settings like this, and it can be a bit intimidating, whereas if board members are actually meeting them in more neutral surroundings, they will actually get a lot better viewpoint and much more kind of detailed view of what they're feeling and what their views are. And I wonder as well, I think for the board that's really important, but of course we've got a lot of elected members who are not part of this board, and I think that would help them to understand that they also have that responsibility in terms of what we need to be doing for our care experienced young people. So I think that's a great idea.
I think before Leanne comes back, what we'll do, Stephanie, please, as an additional recommendation, is work with colleagues in corporate parenting and in social care generally to put together a programme of visits and offer it to everybody, because certainly for me, I would like to visit the health subgroup and hear what they had to say. And I'm particularly interested, actually, in the way that care leavers are supported to manage their health when they do leave care. Because for things like contraception, making sure that you've got the right vaccinations when that time comes along. You know, if you haven't got a family behind you, encouraging you, that sort of out in the adult world for those kinds of things is really important. So hearing firsthand from the young people about how they'd like that to be managed, I think will be important. So if people are happy with that, we'll add that to the recommendations. Leanne, did you want to come back on anything?
You know, I just totally agree with that, really. I mean, the success of corporate parenting is people actually, you have to sort of overemphasise when you start. Any policy paper you read, you have to give it that corporate parenting focus. And while people are always well-meaning, what happens is they struggle to make the leap between their core business, and Councillor Curry, you alluded to that it's place-based as well, but it's about training, it's about that discussion, it's about getting the objectives widely across many organisations. Yeah, thank you.
Yeah, just finally, I think when we had at the start of this municipal term, when we had the induction for all councillors, had a really good session with Celia and the team, and I think it would be worth perhaps repeating that and widening it certainly to this board and to all members of the council, because that was a very insightful session, and certainly going along to the annual barbecue, being able to talk to the children, talk to foster families and to personal assistants and people working with them. I found that very, very helpful and very celebratory, actually, because the young people were quite willing to sort of sit down in that very lovely sunny evening, share their stories. I heard particularly from 3 young people at that time who were moving into their own premises and being supported to do that. You know, I don't know about other people who are parents, but, my kids are in their 40s. I'm still looking after them, doing things with them. And if you're not in a situation where that's available to you, what we can do as corporate parents, should mirror what we do as proper families, shouldn't it, really? Sort of real biological families, as it were. So, okay. I think With that, if there are no more comments then, we're being asked to accept the recommendations. We've got an additional recommendation about a programme of visits, and we'll be watching carefully through Cabinet as well, particularly the outcomes of regulatory visits, all of those things listed under 5.11. Okay, is that agreed, please? Yeah. Thank you. So our next item then is the Community Safety Partnership Strategic Assessment and Community Safety Plan. And thank you, Ian, for joining us today. And as I said at the beginning, this is another example of the way that all of the plans that we have in the council family interact with each other. And I think at Cabinet this week, when we were looking at the new alcohol control areas, in that very extensive report, we heard from people who had kindly joined in the consultation and given their comments just how much crime and antisocial behaviour impacts on people's health and well-being. So it's really important to listen to what you've got to say, ask us what we need to be doing, and I'll let you get on with presenting the report. Thank you.
It's a devil of a day, isn't it? Sorry about that, Chair. The board is asked to note and make comments on the community safety report presented in your bundle. There's a community safety protocol in place where a number of boards are annually presented with an update of its work, hence the reason for this agenda item. For those of you not familiar with the CSP, there are 5 responsible authorities. That's Medway Council, Kent Police, Kent Fire and Rescue Service, the Probation Service and the Integrated Care Board. And you can see how there's a holistic group there that very match the work of this board. So there's those natural synergies that the Chair alluded to. The Chair is Councillor Osborne and the Vice Chair is the new Borough Commander from Kent Police, Chief Inspector Gary Cook. And so a meeting took place last week where he was elected. So that's the latest information. Each year, the Community Safety Partnership produces a strategic assessment. This includes an analysis of the levels and patterns of crime and disorder in our area and uses practical intelligence-led techniques to set priorities and allocate resources. And that's a shared oversight from all of those responsible authorities. This is presented to the Overview and Scrutiny Committee of Medway Council, and you can see in the report the questions that were posed, and probably more importantly, the responses that were provided by the partner agencies. The strategic assessment is provided as attachment, which I'd welcome if you haven't done already to read and consider. This year, we commence a new 3-year community safety plan, and there's an accompanying action plan that sits underneath it. The action plan is updated annually and follows this strategic assessment. From our current strategic assessment, 4 priorities were identified. That's to tackle drugs and alcohol, reduce reoffending, violence against women and girls, and to tackle antisocial behaviour. Work by partners is almost complete on the action plan, which will be taken through the Medway Council democratic process starting in May. This work is completed in time for the first quarterly meeting of the Community Safety Partnership in July. The report also references the annual consultation outcomes, which helps the CSP in putting together this plan. I'm pleased to take any questions if I'm not able to answer them, because obviously the document represents all 5 of those board members. I'll happily take them away and come back with a response.
So that's fine by us. Ian, I'll open it to the rest of the board, and if there are any questions that you're not able to answer, then I'm sure we can take the same attitude. I just would remind people of a couple of things. On page 46 of the agenda and page 10 of the report, there's a hotspots report there of wards, and of course they are the old wards not the new wards. And I know that the new data is available, but obviously this report will need updating. And then just a bit later on page 47, you know, I always like to see Medway high ranking, but it's not very, this is sort of high ranking that you don't want really in these two tables about crime severity and offence rates. And I think it reminds us that we have had difficulties with capacity from the police, capacity from community safety generally, and we've got a long way to go before we actually are where we would like to be, I think. Okay. Anybody got any questions? And bearing in mind, you know, the situation that Ian's described himself coming along today, and if you can't answer, you will get an answer another time. Lauren, please.
Again, thank you, Chair, and thank you for the report, Ian. You know, really welcome the work of the Community Safety Partnership. It's really great to see everybody working together to tackle these very important issues. I did have, I mean, it's not necessarily pulled out in the report, but one of the risks to achieving the aims of the strategy is the lack of resourcing of the Kent Police at the moment, which I'm acutely aware of. I know particularly, I mean, it's right that antisocial behaviour is pulled out as one of the key areas, but I certainly know at the most recent Rochester and Strood Town Centre forums, the police representative was very open about saying their neighbourhood policing teams in those areas were operating at about 50% capacity. So I do have a concern about being able to achieve the aims of this strategy, given the sort of lack of resourcing of our police in Medway and in broader in Kent. I think there's lots of press reports today, isn't there, about the police themselves feeling that they are under-resourced and they aren't being paid enough, and that there are some concerns around being able to retain police officers in those roles. So I think that's definitely a risk that everybody should be aware of, and I would really welcome Medway Council representatives in those meetings really raising that, and particularly raising if there's been any progress in terms of recruiting people to sort of beef up the police presence in those town centre or those neighbourhood policing teams, particularly in Rochester and Strood, where I know there's a real problem. And then just a final question as well, which I expect you may have to take it away, just in respect of paragraph 3.12. This is around tackling violence against women and girls. There's a reference to partners reporting that training courses are being delivered in schools. And I really welcome that, but I would like if we can get some detail around the content of those courses, because one of the things that I find frustrating, and I know a lot of women find frustrating and girls, is that we're being asked all the time to change our behaviour, to carry alarms. And what I really want to see in schools is proactive education, particularly of young boys, about how they treat women. So if we could get through your conversation some clarity about what is the content of those courses, I think that would be really helpful, because I certainly think that that's the area that we should be heading, and would want the police to be in that same space as well.
I'll provide some comments on the neighbourhood policing, and some of that is what I've vicariously learned in meetings, so I obviously can't speak on behalf of Kent Police. Locally, that neighbourhood policing plan was always operating over a period of time, and speaking to the community safety inspector and the new borough commander, they're seeing the rates of officers increase. So we're more aligning ourselves to the aspiration of what they want in Medway, but that still does remain a journey, and it's something both the Community Safety Partnership and Councillor Osborne regularly bring up with the meeting to make sure that we have the level of policing that Medway needs. And that's not to be critical of Kent Police, because locally they desperately want that staffing level as well. Hence their candid comments to you. So rest assured, people are pushing that way. Lots of the work that you're talking about under that VORG umbrella, violence against women and girls, is taking place, and it's taking place in partnership with Amy St Louis within Medway Council. We've been very fortunate to get some additional funding under Safer Streets 5. And so there are quite a lot of promotional activities going on to create that level of confidence that you were talking about amongst women and girls to understand in schools and also outside that. And I can get you some feedback on the work that she's been doing and some of the wider efforts. I know that ranges from encouraging a wholesale attendance at a Barbie film where there was that information to these regional elements that they're doing throughout the borough. But I'm mindful, as you said, that's a twofold process and that needs to take place across all of our community. Every time at the community safety meeting, we have a standing item about VOG, so it remains topical. But I can get you a couple of paragraphs that provide you with an overview. And if you do have any comments, happily take those back to the CSP.
Yeah, thanks very much, Susan. Thank you, Ian, for the report and coming here today. I think I've got a couple of points that I'd like to pick up, if I may. One of them kind of, Lauren was touching on it to start with, in terms of that sense of health, a sense of feeling safe when you go out. I think one of the things that we've picked up on, and I'm talking anecdotally here, but I imagine the data probably shows that Leanne might be able to help on more sort of accurate information about that, is particularly post-COVID, with elderly people not wanting to go out anymore and the impact that has on their mental health and well-being and stuff like that, and certainly to some young people as well, generally not wanting, because that sense of security they don't have in the public realm, the public space anymore. Again, it goes back to that sort of space-related issues. It'd be nice to see more of that reflected in that community safety. I feel safe in my community. I'm happy to go out and about, particularly in relation to elderly people as well. That's just a general point. You probably can't provide too much of an answer on that. The other one was more specific, and I didn't pick it up in the report, was about vapes. And this probably helps because your trading standards background is the illegal sale of vapes and the impact that has on young people's lives. The only reason young people are targeted with vapes is to get them hooked on nicotine to start with. And a lot of the vapes contain more than just nicotine. Some of them have got cannabis in them, and some of them have got cannabis substitutes in them, which are really dangerous. So I just wondered if you had any views on that particular aspect and what we are doing or what we could be doing or should be doing to stop young people. That it was smoking when I was young, getting young people hooked on smoking, and I was one of those. I managed to give it up in my 20s, unfortunately. But nowadays it's vapes, getting them hooked on vapes early on and illegally as well. So it'd be interesting to hear what your view is on that one. And then my final point was in relation to paragraph 7.3, and again, you may not be able to help with this, and I know Tris will probably be picking this up himself, Councillor Osborne, as the chair of this, is the 107 respondents on the survey. I mean, that's not really a survey, actually. It's a number of people who've bothered to fill it in. So I just wondered what might be doing to increase the traction on this kind of survey work, because it is a hugely important survey, again, about community perception of safety, and it's not coming through with only 177 people responding. So those are my points. Thank you very much.
Thank you. A lot of what the work the Community Safety Partnership does is about that perception of crime, you know, and the element that manifests itself, and also the damage that the mere perception of that does. And part of that was the rationale creating the Community Safety Partnership to try and take this holistic approach. But I completely accept what you say in that there's an awful lot of work to do. In terms of the survey, yeah, we could do more. Again, there's a staff resource issue. A lot of the survey takes place online. There's 2 community safety officers that will do engagements. We could do more, and I think the key to that is rolling this out with a bigger social media profile to encourage that on those 2 points. In terms of vapes, we've got a whole plethora of legislation coming in. Vapes are an age-restricted product. And officers can do test purchase and exercise, and we do that regularly. But it's conditional on people reporting those concerns. You can't carry out a test purchase and exercise as a fishing trip. You need that evidence to do that. In terms of the presence of ingredients in them, there's a raft of government legislation that's coming in to remove, through lack of a better phrase, the child appealing element. you'll no longer have bubblegum flavour, cherry flavour, so that's going to make them slightly less attractive. There's also provisions coming in that will remove the disposable vapes, which probably are the most appealing to young people. The intention is to remove those from the marketplace, but there's no ring-fenced funding to make that possible. So that presents us with a challenge, and that's something Medway will have to face. It's a complicated subject because it's a national ban, not a European ban, which means that with relatively porous borders, it's going to take something that takes a lot of work to enforce. In terms of the presence of cannabis, they can obviously have an element, the cannabis oil, but they can't have a content of THC. And we do work with police. If we believe they have any THC in them, then they count as a classified drug, and we make that a referral to them. Officers do an awful lot of work, and last year we seized an awful lot of vapes. There's a maximum size for them, so it remains a work stream. It's a challenging product that does have its place in stop smoking, as I'll defer to public health comments. But with lots of things, it has an unintended consequence, and we're now presented with a challenge. If I have one takeaway that I'd ask, is that if you do have concerns about people, young people using those, if you report it, that enables that team to address those issues. I don't know if I answered all of your questions, Councillor Curry.
Yeah, Leanne's going to come in on this. Thank you, Ian. I mean, I think it is important, Simon, it's a very important issue that you've raised. And safe vaping does play a very important part in our general stop smoking work through public health, and there's been some really good joint work between trading standards and public health, including at all of our events in Medway, making it very clear that these unlicensed vapes are very unsafe and getting actually even more dangerous, it seems. I saw yesterday that this terrible drug trank is being included in some of these unlicensed vapes. And it's absolutely right, I think, to acknowledge that the government have taken steps. But the idea that these steps can be taken effectively with no additional resourcing is a load of nonsense. It's a very difficult thing to police. And although there has been some good work between trading standards and the police and public health in seizing some of these under-the-counter vape sales, as Ian says, it does keep coming. And I think a particular sector that have been terribly affected by this are schools, who have found it very, very difficult. You know, this sort of industry has targeted children. And we've got a lot of children who were not involved in smoking at all, taking up vaping. And these disposable vapes are absolutely environmentally degrading as well. So anything that we can jointly do across the council to get on top of the problem, I think, is really important. And I am looking forward to the work that is still going on getting named community safety officers in every ward. That's taking some restructuring, it's taking some reorganisation, it's in a resource-critical environment, but we're determined to do it, and I think that will make a difference. So before I come to you, Eddie, back to Leanne, please.
I was just going to pick up on the point that you made about older people not wishing to leave their homes and how that interfaces with the whole health and well-being. And Nikki's here, and we'll be doing some work around a fall strategy, because, of course, if you're in your own home, you're probably not as fit, or, you can become frail, then you fall, and the whole cycle begins. So there's that. But really, it's social isolation. So, Ian, thanks for the report. But I was pleased to see under 3.10 the reference to young people, because of course in that paragraph you're talking about social isolation of young people as well, and by its very nature it's difficult to get actual figures. You can take temperature sorts of things like through the Falls strategy and how many people are being admitted to the acute trust, etc., etc. But I think this whole thing around social isolation needs to be seen as part of our preventative agenda in Medway, because if we don't deal with that, we're going to be dealing with things when they get to the very, at the end of the line really, at tier 4 services, those sorts of things, admission to acute trust. So it's really important, I think, in terms of the work going forward, that whole issue around social isolation is dealt with.
Please.
I think Leanne's absolutely spot on, and it's on so many levels, because that isolation is also connected to radicalisation and the work that the team does with the prevent and channel panels, and it's about taking that, but it is, as we repeatedly say, it's that challenge of resources, and it's resources in those extremely hard to address and hard to engage with, which are incredibly staff intensive. But we do form part of the Kent Prevent Board, Kent Medway Prevent Board, and that social isolation is something that we engage with schools with so that they can raise those concerns. So actually we can avoid people ending up in places where we don't want them, which is obviously much more preferable than dealing with the problem.
Thank you. Just before I come to Eddie and to Simon again, I think we can welcome the work that's going on with neighbourhood plans and with the development plans, particularly for places like Chatham, where we're trying very hard now with the local plan on the horizon to build in these safer, more community-friendly spaces. And I think if you walk around Rochester Riverside now, it's a really good example of how a new development, and indeed there's some good development in Cliff like this, how new developments can include comfortable shared spaces that people can go out into and use. And I think, as we give direction to developers about what we want new developments to look like, the more that we can have those kinds of inclusive, safe spaces, the more people will feel that they don't need to feel unsafe or frightened in their own community. But we've got a long way to go. There's no doubt about that. So Eddie first, then Simon again.
Thank you. First of all, I'd like to just reflect on something that Councillor Edwards says about young girls having to go out with protection. Obviously, this should not be necessary. I've got my daughter on those handbag little alarms that sends out a really high-pitched tone and flashes. I've urged her to always carry it. Whether she does, I don't know. But I do know that her and her mother are on a mobile tracking system. But obviously, if something's happened, it's a bit late, isn't it? I think the education of young men, because it's been a while now since I've taught 17-year-olds in further education, but it's not that long ago, and I still heard some of the misogynist language that was really alarming. I always challenged it. I think it's really important to generate debate rather than just having a go. One thing that does concern me, and may sound a bit old-fashioned, I actually do think values of respect and discipline should be there amongst the conversation. I think these two values are very, very important. Ideally, they would come from parents. I do believe that the family core is very important. Reality check. There's lots of parents, their behaviour is even worse than their children. So unfortunately, it then falls down to overworked and now, these days, underpaid teachers to carry this out. So that's the reason why I say this. I will say something positive in the end. You can't improve something unless you identify what's gone wrong in the past. There's a lot of misinformation, as we know, given out. I won't get party political, but there are certain politicians of the past that have promoted basic lies. If you say, oh, we have an increase of police officers, blah, 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 and we're doing well, but all you're doing is replacing those that were lost before, that is not an increase. And I do wonder about some people's ability for basic arithmetic or honesty in what they're saying. So to give you a reality check, I could be just waffling away, but I won't quote, because obviously it was private, but Councillor Esther Cook and myself met our local PC and we had a conversation. And it is quite clear, you know, this so-called, one of the big lies, the so-called fat on the bone, you know, in the public sector. I mean, goodness, what a load of nonsense. And the reality check is when police officers at a certain salary are then spending their time doing a job, which is a lower paid job, doing admin rather than doing policing. That's one of the reality checks on that. However, on a good note, you did mention, Chair, about specific designated police officers. Well, we have one. And to give you an example of this, tomorrow, Saturday and Sunday, Esther and myself are meeting with our PC because we have issues on Hook Meadow and Barnfield Rec. We have particular issues about antisocial behaviour and drug taking. So what I'm looking for from our point of view as a panel, that hopefully over time, that we can actually do something about this and hopefully see an improvement in our figures in our report sometime.
Yeah, thank you, Eddie. All important points. And I think on your last point, it's important to remember that we have got the Drug and Alcohol Reduction Partnership, and there's some good work going on there, helping people who are addicted and trying to prevent people from becoming addicted. And there's a lot of work within the voluntary sector, you know, within the voluntary sector itself and with our voluntary sector partners, trying to reduce isolation in lots of different ways. But, you know, there are issues of resourcing, there are issues of confidence, and I think they, you know, these things do have to play a very clear part in the documents and plans that we're making going forward, which is why I mentioned the importance of the local plan doing that. So, Simon, I'll come back to you.
Yeah, thanks, Virginia, and thank you for a lot of points. And I just wanted to pick up on a couple of things because it sort of, you draw a little diagram and tie things together. I mean, Leanne was talking about the social isolation issue around young people and elderly people and things like that. We've been hearing about the community safety. So, for example, public space protection orders make us feel safer in those community spaces, but more resources are needed. And you've mentioned about the neighbourhood planning and the local plan. And we've also now got our active travel programme together. And one of the things we've managed to do with some of the funding we've got for that is provide free bus travel for young people in holiday periods. And we're going to be doing some more of that again, hopefully in the summer, encouraging young people that they can actually travel easily and quickly around Medway with the right provision. We're building on that. And our local cycling and walking network infrastructure will also include safe routes between places as well. And that's something that you see the tying together of a lot of different strategies coming together in one place to make the community a much healthier and wholesome place, if you like, as well as feeling safe. But I just thought I'd mention that. Thank you.
Thank you very much. Any more comments? Ian, yes, please.
All of the community safety work done by us and the police is based on data. And it's based on reported crime. And the most important thing that we can do and residents can do is, however we feel, is report those crimes. Because if we don't record them, they don't exist. And when it comes to resources and when it comes to initiatives, it's based on that data. And as frustrating as this can be sometimes for residents, if we can make sure that we report those, then we have an accurate picture of what we're dealing with.
Thank you, Ian. And I'm pleased to note that there have been some improvements actually in the police website in terms of people being able to report things more easily than they could before. So I think that there are no more comments, that Steph's captured quite a lot of those things. We're being asked to make any comments or recommendation to the partnership. And I think there's probably about 4 or 5 things that we can draw out there that will make sure go along to the partnership. And the second part of what we're being asked to do is that this is a policy framework document. And once the new community safety plan is completed, it'll be taken to full council. So there are other opportunities for some of these things to go forward. But from the health and wellbeing's point of view, I think if we capture, in my view, there's about 4 or 5 things there that we'd like the partnership to note. And then if everybody's happy, we'll note that the policy framework document will eventually make its way to full council when there'll be further opportunities to comment on that. Is that okay by everyone? Okay, thank you. And thank you very much, Ian, for stepping up today. Now, we're just on the hour. We've got two more substantive items in the work programme. I don't know if anyone wants a comfort break or a quick cup of coffee, or feel free to just get up and make sure that that is available to you before we go on to the next item then. Okay. So the next item is item 7, and I'm pleased to welcome Nikki Teasdale here to say today this is an update on Medway and Swale's Health and Care Partnership Population Health Management Plan. So it's very timely that we've got Morty here today from the ICB. Just want to say a couple of words about the recommendation before we ask you to introduce the report to us. The recommendation is asking us to challenge the ICB in terms of the funding that is directed at the outcomes that this report and all of the interventions the Health and Care Partnership are making. From the health and wellbeing's point of view, we mean challenge in a positive way. I've certainly been very clear and am on the record for saying that when it comes to health inequality, there should be an evidential base and that funding should follow the evidence. And in Medway, we've got some very severe health inequalities, and it's my expectation that the ICB will take note of that and make sure that resources are directed accordingly, which I think is the kind of wider definition of what you mean, Nikki, in your paper by fair. So we can be clear on that, but it's a challenge in the spirit of partnership and in the context that the ICB, sadly, along with the rest of the health service and all public services, is financially challenged and being asked to cut back on many of the things that we hope that we can achieve together. From my point of view, politically, that is completely unsatisfactory. The health service in its entirety has been denuded of funding, 1% every year on a rising curve of demand compared to 4% in the years before 2010. So it's not very surprising that we're in this situation. But the health and care partnerships are place-based partnerships. Ours is Medway and Swale, so we're very pleased to see you here today, Nikki, and to hear about the interventions that the Health and Care Partnership are making to tackle some of the pretty terrible and striking health inequalities that we see. Okay, so with that, Nikki, I'll pass to you.
I'm going to say the biggest challenge is turning on the microphone. Thank you, Chair. And I think I'm going to leave the funding element to last, if I may. And I just want to talk around our population health management programme, which has been in place now since 2021. Now, this programme could not work without every single member within this room, without every organisation that sits and works within the Health and Care Partnership, particularly our voluntary sector, and we've got Jane in the room today, Health Watch colleagues, all our statutory organisations, but more importantly, our wider business communities and people that are our employment agencies and are supporting people working and living and educating our population. So it truly is a whole system partnership programme. And what we're seeing now, we've spent the first couple of years on our population health programme building relationships, and it was building relationships. We've spent a lot of time as partners going out and canvassing and getting to know our communities, but really getting to know our communities. So not going and doing listening events and listening sort of where we go out and we meet with a group and we meet them once. We've been going out and getting to know those communities, and when we're 6 months down the line, then having conversations about what the needs are of those communities in relation to population health. Everything we've done has been evidence-based, and David is sat over here, and without his team, this programme wouldn't be possible, because all the data comes from the public health intelligence team, and what we then do with it is take that data and we deep dive into that data across all our organisations. So that's our primary care partners, our acute colleague partners, our community partners, and then we take that deep dive data and we look at the narrative and the intelligence from our voluntary sector organisations and our operational delivery people on the ground, so that we really triangulate what it is that data is telling us. And from that come the interventions. So it's evidence-driven, and it's targeting those in the highest areas of need. And what we're now seeing is our system working in a really different way. And whilst some of that will obviously need financial investment, most of that doesn't need financial investment. Most of that is about realigning what we're currently doing and using our resource in a slightly different way. And where we started with a population health management approach that was very much around looking at that data and analysing where that need was, we're now at the stage where we've moved that into what we're calling social regeneration. Because when we asked our individuals what it was that they needed to positively impact their health and well-being, not one person came back with a clinical intervention. And we asked over 1,000 individuals. Every single person came back and said something that sat within the wider determinants of health that would positively impact their health outcomes. So on the basis of that, we started contacting our MHS homes, and 1 in 12 people, as we know, in Medway live in a MHS home. And we started to explore the possibility of what they could do differently. And we had a conference, which I know a couple of people around the room were able to attend a couple of weeks ago, where we launched our social regeneration agenda. And just 2 of the actions which link into your points around social isolation that came out of that meeting. 1, MHS Homes and Health are going to be making all the individuals that go into those properties, so the heating engineers, the people that fit the double glazing, I'm sure they've got a name, but frailty assessors. So we're going to train those individuals to be frailty assessors so that they can do direct referrals into interventions and services, because a lot of those people, as you say, aren't coming out and aren't accessing services. But that's not going to cost our system any money. That's just doing things slightly differently. One of the other things that came out, which links into the conversation that we just had around children, we know from a clinical element that we have very, very high rates of self-harm and high rates that hit our acute services. So these are children at the top end that end up in our emergency departments. So from that conference, we're now realigning our resource, and we looked at the college data and the schools data, and what we're seeing is in health is the tip of the iceberg, but what they're seeing in college and education is so much greater than what we're seeing. So from that conference and through the social regeneration and population health management programme, we're now actively putting interventions in place so that we're putting the prevention mechanisms from health into education to support, because they're not equipped to deal with what they're currently dealing with. There's so much in that paper, and I'm certainly it's a complete system-wide team effort that I think we're all incredibly proud of. We walked away with 3 HealthWatch recognitions awards at the HealthWatch meeting a couple of weeks ago for work in that programme, and that's not health-led work, that's system-led work. That was we wouldn't have been able to achieve any of that without system partners. So I'll leave that bit there. From a funding point of view, and we've been having ongoing conversations, and we absolutely appreciate the financial position that we're currently in. The funding issue started way before the ICB came into fruition. We know that we were underfunded for years as a CCG within this patch, and there's lots of reasons for that we don't need to revisit now, because we can't change the past. But from a system point of view, we have got some of the highest levels of need and deprivation within our patch, and we know that you need more funding to level up. And you just need to look at Chris Whitty reports and things where you're talking about levelling up populations. So we know that we need a higher base rate if we're going to give those people the same opportunities as people living in affluent areas. So we are looking, obviously, for fair share allocation or a hybrid model of fair share allocation, and we're in conversations with the ICB in conjunction with that financial deficit to sort of see how we can sort of mobilise that. But the conversations are certainly happening. In relation to, because there are some risks in there, and again, we've actually got a meeting next week to discuss, because we have got a couple of schemes that were put in place last year. The criteria for health and equality funding has altered, the national guidance has altered, and under the old criteria, those programmes have been stopped. So at the moment, those programmes are at risk. What we've done as a team is relook at those programmes, relook at the scope of those, so that we can link the KPIs metrics to the new requirements. So we're hopeful that we can find funding sources for those going forward. But linking it back to the social regeneration programme, the social regeneration programme is about looking at our systems priorities, so not just health and wellbeing, but education's priorities and our housing providers' priorities. And actually, they're all very similar. So we're not looking at necessarily funding from our statutory organisations to support that programme. We're looking at funding outside of that. So we're looking at education and health, so that we meet their priorities as well. So there's a lot going on. It's evidence-driven. It's partnership. I think it's something as a system we're quite proud of. And I'll leave it there for questions. Thank you.
Thank you, Nikki. And before I come to questions, look, I think that management of resources in a different way is clearly turning a result, and where the Marmot cities have started, and particularly in Coventry, they really are seeing impactful change. So I think certainly recognition from me, and I hope from the board, that the management of resources and the sort of, direction of resource is a critical part of achieving these outcomes. Being aware of the context is only part of that, and we certainly don't want to find ourselves in a position where successful interventions are having to be ceased because we're not getting the allocation that we need. And the strong evidence base that you've cited, that I spoke about early on, that I'm very pleased we can rely on our public health team to provide, it is absolutely critical. Otherwise, these strategies, all of them, die on the page. They have to be updated, they have to be constantly monitored, and if we're not seeing the outcomes that there's consensus about achieving, then we do have to change direction, and whether that's funding direction or other kinds of ways of looking at is in the lap. So I'm pleased to hear about the meeting next week. Consensus from this board, the wider determinants of health, called, I think, more relatably, the building blocks of health, have to be a shared responsibility. And I've been pleased to hear about that work with MHS, because I think in some respects that's been a long time coming for such a significant partner for Medway. And part of our falls prevention strategy is involving work with them as well, because when you get that kind of granular data and you find, as we have done, that 40% of falls take place all in the same ward, and that ward happens to be one where there's an enormous amount of MHS property, then there's no denying about that sort of co-production of responsibility there. Okay. Anyone else?
I want to say thank you very much. I was really impressed with the report. I just think that the approach that's being taken, moving away from a kind of population-based allocation to where it's most needed, is really welcome. There are huge disparities in health outcomes from the least deprived in our community, so I think it's so important that we are directing these resources to try and level up the disparities that we have there. I want to say as well done on the awards. I noticed that one of the nominations was for your childhood asthma which is the thing that I wanted to talk about here. I see, well, I know from experience that childhood asthma can be a really debilitating and serious matter. It can lead to a lot of absence from school, which can end up in a spiral. And I see that we have asthma-friendly schools who are now coming on board, which I think is really to be welcomed. I will say though, I think the number of schools who are currently signed up is quite small. So I was really wondering how we're looking to increase this. And again, coming back to the targeting of more deprived areas, if we are able to direct this to schools whose catchment areas are in our more deprived communities to make sure that they're being given that opportunity to come on board. So just wondering really what the plan is for expanding that scheme to more schools.
Thank you. And the targeted areas, so we start with the whole of the population health programme, regardless what topic it is, we start with the highest areas need. So it's not just the highest levels of deprivation. Obviously, they have to have children and young people with asthma in them as well. But yeah, we're targeting that and triangulating that data. So the targeted approach is on those areas. It's a small amount of schools so far, but there's a plan to roll out. So all schools across Medway by the end of this financial year will be child-friendly schools. And it's not just the schools that we're targeting, it's the sports facilities and sports clubs and youth clubs and anywhere where children are congregating, so that we can ensure that the people and the adults that are looking after them understand how to use inhalers and understand. We're linked in with the green doctors so that we can, once you're asthma friendly, whether you're a sports club or a school, you will get a report from the green doctors to say it's really high pollution today, so actually these children and young people need to be staying indoors and things like that. So it's not just about the inhaler use and not having it locked in a cupboard, but yeah, targeting the higher areas, and we've got a plan for rollout.
Thank you. Can I just say, I've said this before, we've had other reports, I'm always pleased when there's something that's easy for me to read. That means I can cope with it. Thank you. The point one, fair share allocation, getting to the point, succinct. A couple of things caught my eye. I was amazed to see that historically there has not been the concept of fair share allocation, because to me it's a no-brainer that it should be done like that, but I suppose people with other attitudes see things differently. I'm also pleased to say that you stated what to me is the blinding obvious, but it doesn't seem to be, which is that there's a correlation between less wealthy areas, health, and for our board, there's a direct link between physical ill health, your own personal resources, and your well-being. I think when people never experience this, they just don't get it. I know what I'm talking about. And to show that some people don't get it, just make a quick comment. On question time, this issue came up about correlation and well-being. There was one panel member that tried to argue that that isn't right, that the people are wealthy. He came up with some stats.
So the population health management programme is funded. So any activity that as a health and care partnership we're undertaking, so that's all the statutory providers and our voluntary sector organisations, any of our direction of travel has a population health management base to it. So it all comes from the data that comes from the public health team. In relation to resource, I've sort of operated on the goodwill and the I suppose to appoint people that want to come on board, because the more people that are on board and wanting to come on this journey, and we're really fortunate in Medway that we've got the leadership forum who are very proactive in sort of driving that agenda forward. And, you know, I think if you take those positive people that want to do things differently and want to change job descriptions, we've got so much asset within our community. And yes, sometimes you need to fund it, but actually by doing things differently and operating differently as a system, you don't necessarily need to come back to money. And when money is so tight across all organisations, you know, we need to think differently. So I haven't got a magic resource out there, but we've got so much goodwill in Medway to do things differently.
Sorry, I don't even know this is a legitimate way forward, but do you have a relationship with the fantastic MVA for all the fantastic work they do to generate funds? Because they're a voluntary organisation, or something it's appropriate anyway. So.
Yeah, so we've MVA. One of the first things that we did when we started this programme was campaign for every year to get MVA as board members on every single board within the Health and Care Partnership. So Jane, I keep Jane very, very busy, and through that we obviously have reach into across and Swale 1,500 voluntary sector organisations. That actually went off. Yeah, we now have a network of voluntary organisations who we've built trust with, who we've built relationships with, which is now actively working and showing tangible outcomes.
So there's a working relationship.
Yes, there is.
That's what I was after, actually. Thank you.
Thank you, Chair, and thank you for the report, Nikki. Really interesting, and wanted to thank you also for the Social Regeneration Conference. It's really exciting and really welcome. And I just wanted to, it's not really a question, more of a comment and a request. Really welcome maybe us having a conversation about how we can embed the outputs from that Social Regeneration Conference into how we approach regeneration here in Medway. So I'm always banging the drum that we shouldn't be thinking about regeneration in terms of just the economy or just creating jobs or better buildings or better roads. We also need to be thinking about people. And I know certainly we're trying to embed that approach in things like Gillingham, where we're having a high street task force. We're getting everyone around the table. We had a meeting recently, maybe last week or the week previously, and we had somebody from public health there talking about the high prevalence of smoking in the area and how we could tackle that. So would really just want to welcome a conversation about how we could really embed that more broadly across the other town centres as well.
Absolutely, and actually following a conversation this morning, you're on my hit list already. So,
Simon, please.
Yeah, thanks very much, Susan. Thank you very much for the report. I can tell by the enthusiasm that you've got. You love what you do. It's just quite exciting. And it's clearly a no-brainer, as Eddie was saying, about the approach here is absolutely smart in every sense of the word. And I was going to, actually, Tracy picked up on the main points about the asthma issue. And I was going to put a request forward that Luton Primary can, but I think you probably got it targeted already. And I just wanted to mention how good MASH are, Medway Asthma Self-Help Group. They've been to our school and helped out with the nurse there as well, so it's good links there. But you're already doing that. But one approach that we're using in the climate area, we're targeting schools for climate schools and eco-friendly schools and stuff, but we're also now looking very closely at the trust boards, because the trusts are managing most of our schools, and we've got access to those boards, and we can talk to them and we can get them on board. And if they're in, then the whole school system joins in as well, and that's it's perhaps something you're already doing. You are already doing it. There you go. So my last point, then I'll go quickly, and then Jane can come in. Is about the frailty assessments. That sounds really interesting, actually. And I just wondered, and Teresa picked up on it about MHS homes and stuff like that, whether it's something members should be trained in as well, because we visit a lot of people in our wards. And, you know, picking up the markers that would tell us that somebody needs extra help, that wouldn't be such a bad thing. So I'm just wondering if it's something we should pick up and have some member training on that sort of thing as well.
Just coming back on that, I think that's certainly something that I've been talking with public health colleagues with, to do something specific, picking up on the way that some of these strategies, particularly our own health and wellbeing strategy, you know, it impacts, because obviously that should sit under and alongside and within this strategy as well. A huge amount of work has gone into it. So I think that's important, Simon, something that we're, you know, thinking of for the new municipal year. Jane, please, then Habib, okay?
Is it working now? Yes. Right. Okay. They're a bit temperamental, these microphones, aren't they? Just to address your point, Councillor Peake, can I just reiterate what Nikki was saying about the relationship with the voluntary sector in Medway, and now increasingly so as well. It's taken a bit of developing this relationship, but it's a very, very good one now. And I think I probably need to say that one of the reasons why it's taken a bit of relationship building is because the voluntary sector traditionally are composed of a lot of organisations where people have been doing the job for a long time and maybe a little bit cynical and sceptical of new initiatives because they've seen it all before. And also, some of those people have been let down by the NHS, by other funding, you know, local authorities, possibly through no intention of that at the time, but nevertheless they felt significantly let down. And therefore, there is a bit of a culture in the voluntary sector as being a little bit sceptical to new initiatives. Now, that's not the case here with this particular initiative. I think I can probably say that out of our 1,500 organisations that we have on our database, which come under the heading of third sector, most of them know about what is happening here with this particular initiative and are very much sold in favour of it and will be very involved with it if they can. So that's been a real achievement, I think, of the current Health and Care Partnership to make sure that those links are developed and that partnership is now working really, really well. So that's number one. Number two, the Social Regeneration Conference that was Nikki's referred to, that quite a lot of my colleagues were at, just to give you an example here of some of that die-hard mentality. One of the most rigorous die-harders who I've worked with in the voluntary sector, who was also there, actually said to me afterwards, that may work. So that's a real achievement, all right, in terms of the progress, I think, of this relationship that we've got now with health, in terms of, we all have a common aim, and that's improving the health outcomes of those communities that we're working with. That's the common aim, so it's a bit of a no-brainer that we should, you know, we should work this way. Yeah.
Jane Habib, please, and then I'll come to you, Malty.
Thank you, Chair. Nikki, in your response earlier, you mentioned tangible outcome, and I know that the partnership is still in its infancy, starting back in 2021. On page 78, you mentioned in your report some expected impact of the program. Now, how is this being measured currently, and when are we likely to see some results on these expected impact?
It's gone.
It's just shut down. Sorry, I just need to get to the page that you're referring to. So we've already got outcomes on all the programmes that we've got in place, and we've got external people doing some evaluation on some of those. So particularly the programme around social prescribing, and part of that is having an external company come in and scrutinise. We're also using university researchers to do evaluation, just to check that we're on the right track. We've also used HealthWatch, so HealthWatch and EK360 have also done some evaluation for us, and we've actually at points changed the direction of the programme slightly on the back of that evaluation. So it's not something that we're doing once, and it's an ongoing, and we've got a group set up within the Health and Care Partnership that's sole responsibility is to do that. We're also linked in with the work that's being led through the voluntary sector and the Alliance, which is looking at how we measure the impact of what the voluntary sector is doing on health outcomes, so we can measure the worth, if you like, of the voluntary sector, so that we can support sort of funding streams and work programmes going forward. So there's a lot going on, and we've certainly started to collate that evidence.
Can I come back and share? Yeah, just any timeline when you think such information will be available.
We can share it now. So I can share it with the committee. Yeah.
That's fine. If that comes to Stephanie, then we'll make sure that it's shared with you. Because obviously it's very important to have the ICB's views and perceptions on all of this.
Thank you, Nikki, and councillors and colleagues, really having this wonderful debate. This subject is not only important from the ICB's perspective, because this is one of our statutory duties, but is very close to my own heart as a public health consultant and a colleague belonging to David's fraternity. So really, really important, important subject. We've heard about the population health management, and the paper is titled that, and Nikki has clarified, it is about population health management is an approach to understand our population needs and those who would benefit by that need most. And of course, within that spirit, we use information to inform our targeted interventions, through which we get the evidence that Councillor Tejan, you have talked about in terms of understanding what the impact is. And therefore, the Health Inequalities Programme has really been wanting to focus at looking at where we target, where we can make most impact to our population across Kent and Medway, and of course acknowledging the inequalities, persistence inequalities in Medway. I want to acknowledge that at this point. And hence, the challenging times of the finances that we have been having, as Councillor Murray has really eloquently put in, the challenges that we are having as a health sector generally, we've had to make some tough decisions. On that point, I'd like to pick up 2 points. One is about the resourcing, which is about, which was raised by Councillor Peake in terms of the resourcing. So we fund across the 4 healthcare partnerships, 1 dedicated person to address population health management and health inequalities. We don't necessarily interfere with how that resource is used, because that is left to colleagues like Nikki, who would really use their discretion to how that person or that resource is used in terms of the focusing on PHM, population health management, and or health inequalities. The ICB continues to be really committed to addressing health inequalities, not because it is our statutory duty, but also because we recognize the importance of the core determinants, the social determinants on health outcomes. We do recognize the importance of preventative activities and prevention services, and hence to that effect we have got 3 subcommittees of our inequalities, population health management, health inequalities committee. We have got 3 subcommittees which have been dedicated to look at the subcommittee around prevention, which is chaired by our DPH in Kent, Director of Public Health in Kent. And under his leadership, we all come together, and is co-chaired by Jane herself, that subcommittee. Additionally, James, our DPH in Medway, chairs our Health Inequalities Subcommittee. We address, discuss, and take his direction on all matters around health inequalities. And of course, the PHM subcommittee is chaired by Chief Strategy Officer in the ICB, Vincent, who many of you know. So ICB has got that dedicated time, resource, approach, governance to make sure that we provide that preventative element to addressing health inequalities. The other key few things that in terms of the resource, ICB continues to resource around about 3.8 million across 4 health and care partnerships. And those are the programs that have been referred to in this report. Those similar programs are running across other health and care partnerships as well. What we are looking into, how do we demonstrate the measurable impact that Councillor Tejan, you have changed, so that we can then make these things scalable, provide the evidence much needed to across, probably we should, around the country as well, not only just in Kent and Medway. So it's about that, collecting that evidence to be able to demonstrate the impact through this targeted work. Finally, I would just really like to say that social regeneration, I was really pleased to hear what Councillor Edwards talked about in relation to, it's not just about putting money, the housing regeneration, road regeneration, etc. It's also about that social re-engineering that I personally felt when I attended the conference a few weeks ago that Nikki fantastically hosted. That is about how do we re-engineer our work and efforts going on in the society across all the statutory and non-statutory partners. And I came away thinking that that's a really important aspect of re-engineering our work. And with that in mind, what I would really recommend, Councillor Murray, with your permission, is that how do we use all our available resources across health, social care, as well as private and voluntary sector, in terms of using across the transformation of the programs. So currently there are few transformation programs that are taking place, such as the primary care transformation, mental health transformation, as well as community transformation. So big transformation programs are taking place. How do we bring that opportunity, how do we take that opportunity to address health inequalities, and not just really look at the funding side of the things that we have been talking about? So I would really welcome a recommendation around collaborative working around transformation programs to address health inequalities across health and social care. Thank you.
Okay. Nikki, I'm going to come to you to sort of close the item. You've heard what Maltese got to say there, and I think we have to be frank with one another in that the specific request that you've made about moving from headcount to fair share is still being developed as far as we're concerned. I think there's absolute consensus about the impact that the wider determinants, the building blocks of health have on our ability to get the health inequality outcomes that we want to have. That there's consensus across. But within all of the different organisations, and Morty's mentioned there, three elements of transformation that I'm not expecting everybody around the table to be necessarily familiar with, because clearly we haven't, everybody around the table of this board isn't on, for example, health scrutiny, so they wouldn't necessarily, or indeed on the integrated care partnerships, they wouldn't necessarily have the level of insight into those things that you've mentioned. But the point is well made that if we've got a transformation programme on any element of a health service, we ought to be able to think about and determine the way that transformation is going to help us reduce health inequality, or else there isn't any point in doing it in the first place, I think is a sort of summarised way of saying that. So I'll come to you, Nikki, now. We've got consensus on the sort of co-production and the need to use the wider determinants, the building blocks of health, to make an impact on this as well. Malty has confirmed that the ICB's statutory responsibility and the level of resourcing that they've got. But I don't think, on this occasion, we're in a position to say that the fair share allocation movement that you're asking for here is actually in place yet. Okay?
Thank you, and it's not, but it's not in place in several other areas of the country either. So it's not that we're an outlier with fair share allocation, and it's something that we're working on. The obviously the turning the tide and the breaking barriers work that's being led by obviously Chris Whitty and Lord Patel, and we're working very closely with those to talk about how we move from a population headcount allocation, which is currently And this isn't just about the health inequality funding that's in this document. It's about how we start to think about how we move from a population headcount allocation to a need-based allocation, and what that hybrid model might look like in the interim, because we're not where we need to be, and therefore we cannot resource how we need to resource to fully address health inequality. I absolutely fully agree with but I think everything that we've done over the last 3 years wouldn't have been possible without true collaboration and authentic co-production from our communities. So, and we also, the programmes that Malti mentioned, obviously the Health and Care Partnership is cited on those programmes, and anything that we do as a Health and Care Partnership comes from a population health management base. So it all comes from that same methodology. So I don't think that's in question. But I think, and maybe we need to think politically as to how we do sort of government, because this isn't policy. It's not policy for fair share allocation, and perhaps it should be.
I mean, I think that's an absolutely fair way to coin a fair share phrase, to sort of sum up, we're in a headcount arena now, and I've long been clear that when we've got a weight of evidence, we should be moving resource to where the evidence is taking us to get those impacts quickly. And as I say, the Marmot work has really shown the possibility of that. So I think this is a very determined work in progress. It's quite right for Nikki to say that, the feat of this predates the ICB. The ICB is a still relatively new governance and commissioning incarnation of the health service. And there isn't, I'm afraid, consistency across the country in any way at all. They all operate completely differently. And I think here in Kent and Medway, one of the issues that we felt quite keenly when the old clinical commissioning group was dismantled was that we had a clinical commissioning group for Medway, and going into Kent might put us in a position where the level of resource, effectively 25% of the whole of Kent, might be diminished by coming together. Thus far, I think that it's fair to say that the conversation has stayed very frank and open, hasn't it, Malti? And that recognition of the level of health inequality and the persistence and pervasive nature of it for Medway and Swale, now encapsulated, sitting under the ICB and the Health and Care Partnership. You can see why when you start saying things like this to the public, they get a bit turned off. They're interested in the delivery of the service at the point that they encounter them, and that's why the talking that you've done and the work that you've done with the voluntary sector is so important. So I'm going to say we can note the contents of the report, and in the second recommendation there about challenging funding allocations, I think we can say that that is a work in progress, that fair share allocation is seen as desirable by the Health and Care Partnership, but there's a long way to go, if you're happy with that, Nikki. And, it coming at all, this doesn't have to be encapsulated in the recommendation, depends on our ability to continue to keep the channels of communication open and work together. There's no doubt about that. Okay. Is everybody happy with that? Right. Thank you very much. Is our own strategy. Thank you, Habib. Yeah, I've been infected by the lack of turning on the mic today. Our own health and wellbeing strategy has been finalised. It has been through cabinet. A huge amount of work has gone into refreshing it and to making sure that it answers all of Medway's need. But again, it doesn't die on the page. It connects up with the tremendous work that we're just starting to do with the Health Determinants Research Collaboration. And these two things have to be seen absolutely in tandem. The ICB is commissioning, sitting over there, but if the outcomes for that particular strategy and the log frame of sort of detail within it don't accord with our health and wellbeing strategy, then we're not where we should be. So it's important always to keep our eye on the ball of that. So thank you, David.
Right, thank you. Yes, as we're running a bit late, I'll keep my introduction brief and assume that everybody's read the paper. So we spent about 18 months working together across the system to develop the integrated care strategy. And when that was approved, it was acknowledged that we needed to have some way of ensuring that we have plans and actions in place to deliver on everything that we said we were going to deliver within the strategy. As a result, we have started developing the shared delivery plan across the system. And this aims to illustrate that we do have actions or plans in place to deliver everything that we said we would. It's important to acknowledge that it would be impossible to include every single plan, every single strategy that there is across the system, across all the different partners. So it could never be a complete listing of everything. But what we wanted to do is make it illustrative to show that there is something there for each element. There are, however, some important areas where we recognize that we do want to add some more information within the shared delivery plan, and those have been outlined within the paper itself. One particularly important one is Medway, for us here in Medway, is the Joint Local Health and Wellbeing Strategy that Councillor Murray has just referred to. This was approved earlier this week by Medway Council's Cabinet. And as we now take the next step with the Joint Local Health and Wellbeing Strategy, we will be developing something similar to develop plans or identify plans to ensure that we deliver key outcomes on the Joint Local Health and Wellbeing Strategy, and those will be reflected within the shared delivery plan. Within the paper, I also talk about the Joint Forward Plan. So this is the requirements that NHS England places on ICPs. A very important document that needs to be produced by the local NHS. And if I may ask Morty maybe just to say a few words specifically about that, just briefly, if that's okay.
That's absolutely fine. Morty, do you want to go ahead?
Thank you, David, for introducing. As councillors and colleagues would know, that NHS is one of the statutory partners in the ICS system. And as David already said, that we are legislatively required to produce a joint forward plan, which we did produce last year. But given that our partnership has now strengthened, the fact that we have done a fantastic ICS strategy, as well as produced a joint log frame to demonstrate our improvement, we feel that we don't need to do a separate joint forward plan, but ICS shared delivery plan is that joint forward plan representing the NHS's plan, which is legislatively required. We are required to submit this plan by 30th of June, and we have to take it through to all our NHS bodies that are in Kent and Medway system. And we have worked closely with our NHS bodies. Colleagues like Matt and others have contributed and provided us with constructive challenge, collaborative working to make sure that our outcomes for people in Kent and Medway do demonstrate that how we improve. With that in mind, we would really like to present this as our formal document to NHS England and as part of our legal duty. And therefore, I would really request this Health and Wellbeing Board to make a note of it, because we are required to make sure that our Health and Board across Kent and Medway signs this plan off. As well as we would welcome your comments on it. So we don't want it to be just a plan that we are requesting, please sign it off. We genuinely want your feedback on it, and David's email address is on the opening paper. He is part of our project team. In fact, he's a really crucial member of that project team who's supporting us in progressing this plan. So we would request your feedback as our statutory requirement, as well as as genuine feedback on how we can improve and whether this is something that you as the Health and Wellbeing Board can sign off. So thank you.
Thank you. So just before I take any other comments, look, I'm very aware this is a huge document, and I don't expect that everybody around the table has had an opportunity to read it in detail, or even if you have, that it would necessarily be meaningful. What I do want to say is, to get it to this stage, there have been a number of workshops, a number of seminars that have helped put this together. So across the system, there's been work on this. So it's not come cold to us today to try and make a decision on. There's been a whole lot of work that's gone into it, and you'll see as you go through the document that there are gaps because the measurability of the documents, the determination of exactly what outcome can be realistic are yet to be put into place. So I think, I mean, obviously I'm happy I'm conscious of the time. I'm happy for anybody to comment quickly, but I think what might be useful, and some help from you on this, David, is to do a special short session for the members of the board to have a look at this so that we can sort of work together to get some meaningful summarised comments to you from this board's perspective in a timely way. So hopefully by, perhaps if I just say briefly, the second week in May, and perhaps even do that possibly over Teams if we need to give people a bit more reading time, because I don't want anything that comes forward from this meeting today having had to look at these two detailed documents that obviously I and others around the table have seen a lot of before, and then feel that, you know, that's all we've got to say about it because a lot has been said already. Is that okay with everybody? Yeah. I think it does make sense, because I think there is a need to take people through this. And I've said at the partnership, some of the language that's used in putting this together doesn't necessarily have much resonance with a more diverse group of people who are nevertheless part of the family of organisations that need to put this together. So I think that should be doable, David, shouldn't it?
Yes, I think it should be possible. We just need to keep in mind the timing, so to make sure that the documents are able to make their way through the other governance routes.
Yeah. So it's not as if there's nothing has happened already. A lot of this has been, worked into and referred to when we're putting together our own health and wellbeing strategy, also a statutory document. And I think if we can do that and get a reasonable summary form to you by meeting together for an hour outside of the board normally, to do this, I think that would mean that we've got a meaningful, on-the-record response from this board. Is that okay with you, Morty? Yeah. Do you want to come back? Yeah.
Thank you. Thank you. Yes, we would really work with David to support in whatever way we can to make that happen. And secondly, what I'd really also like to reiterate is that the work and the contribution of the NHS is really weaved in. That is the main purpose of doing this shared delivery plan. Again, recognizing the earlier conversation we have had that we are a statutory partner, but the improvement in outcomes can only be done through that collaborative and joined up work, and hence it is weaved in, and we would really welcome the approach you have said, because that is how it can then be looked into and commented on. So David, we can work with you offline in terms of meeting the timelines. Thank you.
Okay, thank you. Any comments, anybody got? Yes, Habib.
Just a little comment from me. The report mentioned Medway Neurological Network doing a lot of work. But I don't see where we are capturing neurological diversity earlier on in the strategy before people reach adulthood. Is there any provision for that?
Something that I can go away and look into as well, but just really initial responses, neurological side of things, as you can imagine, is a spectrum of conditions. If we were looking at neurodiversity, that would be something specific neurological conditions such as Parkinson's or stroke, etc. Those would be different as well. So it hasn't gone into that level of detail, and we want to acknowledge that. The outcomes here are more about where we can make a shared contribution, but that doesn't replace the individual work that different organizations and different professional groups are doing. So, but to the specific point that you have raised, I can go away and look into and come back. Thank you.
Matt, please.
See if I can beat the yes. Yeah, check me out. So just to add to that, and just to give you some assurance, actually, so taking from my own organisation, from the Acute Trust, we've literally just published our own clinical strategy and a suite of others, which absolutely at the heart of it has exactly what you're looking at here. So to take that point, the theme piece and those wider, broader pieces from the ICB perspective and the ICS plan and strategy, and then we've knitted those into how it's delivered, if you like, from our perspective for the people of Medway and Swale. So just to give you some of that context as well, so those exact points around some of those clinical areas of stroke or dementia and so on and so forth, they are weaved within there from the practical, if you like, coalface piece, and then you've got the themes, if you like, of that ICS plan. So just to give you that context, that's how we've worked, and because we've been working very closely together, we've been able to actually publish ours, knowing full well that it does fully meet with and knit into the wider system one. And we've had to do that because we can't just look, we had a whole conversation around resourcing now, we can't just look internally anymore. Our strategy is as much about looking in as it is also looking out and how we work for our whole population across Kent and Medway, and how we can better use our resources, load the system a little bit differently, maybe some of those resources aren't quite in the right place, and those kind of things as well. So that is really at the core of these things. So it's just to give you that assurance that is part of how it's working now.
Thank you, Matt. And look, Habib, it's a point well made, and I've alluded to it, haven't I? The relatability of this kind of document with ordinary people who are trying to spot, you know, where's my place in this and how's it going to help me, is a gap. We need to think a bit differently about how we manage to do that. I was at the Neurological Network's AGM myself. They were disappointed when they heard about what the ICB was doing, that there wasn't any kind of specific mention of their needs. There wouldn't be at strategic level, but there absolutely definitely is when we think about how the specialist service fit into that framework. But you know, they wouldn't be the only group who might feel that their needs are somehow not being met when they look at a document like this, which is why I say us taking it away and having a bit of a closer look at it together to give that, if you like, more diverse perspective on how these things can work, I think is important, actually. And that's another example of perhaps why we need to do it. And there's some work, I think, for us to do, Jane, within the voluntary sector about that very thing. And it will be, perhaps through the Transformation Academy, something that we could pick up. That might be useful. So if we can add a note about that. Poor Steph at this board, she does great minutes, actually, from fantastically sort of leapfrogging around. Yes, Eddie?
You just reminded me, I wanted to ask a question, because I'm still not quite sure what our role on this board is. Are we somebody that looks at reports and reflects and we encourage, or do we have more hands-on? It will come apparent what I'm saying, because at the excellent showcase yesterday, led by the excellent councillor Lauren Edwards, I went to the stall that had the, I can't say that word, neuro whatever, please help me, that one, thank you. And spoke to a chap called Phil. Yeah, whatever his surname is, because I can't remember surnames either. That's it, thank you. And because there's an element of, I'm not saying stress, but obviously concern about how they don't have funding lined up. And I did say to him, I'm going to the Health and Wellbeing Board tomorrow, I'm going to mention you, and I've only just remembered that I said that. But so my role, our question about our role, are we in a role where we can try to encourage, to say it another way, to look at funding for a particular group like that?
I think I'm going to stop you there, Eddie. Okay. This is a statutory body with a particular function to advance the health and well-being needs of the people of Medway. But on that kind of granular detail as to whether, you know, we can say here that the neurological network needs more money, I think the answer to that is no, because we haven't got a budget that we can deploy. But what we certainly can do is take into mind the way that the neurological network can interact and engage with everybody else to make sure that the views of the people that they represent come into the documents that we're talking about today. Yeah, absolutely. So, you know, that is really good that they were at the event yesterday. It's great that they talked to you, but I would say, you know, just be a bit careful about what the Health and Wellbeing Board... No, absolutely. Yeah, I'm sure you didn't, but just, you know, as a word of warning with your lovely friendly face, we have got a particular function, and it is a statutory function, and we haven't got a budget that we can promise anybody a slice of. Okay. So, you know, and I think the general point that we made near the beginning of the meeting, that sort of ongoing development for members is important, isn't it? You know, because we sit, you know, some of us, we sit on lots of things, and understanding the way that the different boards interact with each other and that what falls out of them in terms of strategy interact with each other is important. Okay. So I'm going to go to the recommendations. I think it's fair to say we've noticed progress, and thank you, Morty, and David, for all of the work that's gone into developing the shared delivery plan for the integrated care strategy, because the strategy on its own can't do anything. It's got to have a delivery plan so that it can actually reach people. We've had a quick look at the role of all the partners, and we're going to do a bit more work on that. And I guess the way we're going to do that, the third recommendation, is that we're going to come back to the ICB with the things that we think are most important to give some assurance that that delivery can happen. Okay, is everyone happy with that? Thank you. So on to our last item, which is the work programme, please. So we've got nothing to add to the work programme. So are you happy to take it as read? We've got some interesting themes coming up. Yes, Simon, please.
Yeah, thank you very much. I just wanted to raise two particular issues in relation to the portfolio I cover. One is that the climate action plan for Medway is being refreshed. The public consultation started this month. So I think it would be helpful, particularly looking at the integrated care strategy, which does have one of the shared outcomes is in relation to that. Maybe later in the year, something from the climate action team coming along to talk about their work and what that is. And equally, in relation to the local plan, the Reg 18B, the next phase of consultation, starts at the beginning of June for 6 weeks. And obviously, in the context of the local plan, we're looking at a population rise of about 50,000 people in Medway. So the sort of infrastructure requirements for that is probably something this board might want to be thinking about as well. So I don't know whether it's worth having the local plan team come along perhaps later in the year. That's not due to be published till 2026, but the climate action plan is 2025 publication.
Absolutely, Simon. You've done a really good job in flying the flag for climate on this board, so we'll definitely add that to the work programme. We said that we would do it, and I'll work with Steph and everyone else to make sure that we get a date for that, because having a themed meeting in the way that we've done before seems to work. We've deferred the women's health one from this board until June, but that's a very important item that we'll be devoting a large chunk of the June board for, so that will come later in the year, but we'll definitely do it. And I think it's absolutely right to say that there should be a formal response to the local plan from this board. I don't think that has happened before, but I think it definitely should. Okay, so thank you. Yes, Eddie.
Keep talking, just very brief. Also yesterday, one of the stalls, I had a really enthusiastic and interesting conversation with the Medway environment team, 2 people there. I don't know if your ears are burning or not. It'd be fantastic, to get their people on the ground, if you like, an idea of their role into your report. How well the team is basically doing, not as a case of criticism, but I mean, they must be having challenges. I'd be really interested to see that anyway.
Well, let's work with you, Simon, on bringing that into the special item that we're going to have on climate. Okay. Thank you very much for your attendance. Making a response to the integrated care strategy, Morty. Thank you for coming today, and to all the substitutes who came along today. Okay, thank you.